And now, sitting in for Josiane, once again, is Danny Darrow. And hello, everybody. I'm Danny Darrow, and I'd like to welcome you once again to the Josiane Show, Persons of Interest. And once again, we have a very wonderful doctor over here who's double board certified, and his name is Dr. Kevin Ende. And Kevin, welcome once again to another edition of the Persons of Interest show.
Thanks, Danny. Thanks for having me on the show again. It's great to see that the public has an interest in what I do.
Well, thank you for having me on the show also, Kevin, being here with you, because I love being here with you.
Sounds good to me.
And why don't we just pick up from where we left off on the last show that we did, where you made the person that you operated on look like a movie star.
Sure.
With
let's bring her back up.
Okay, let's bring her up again.
She was certainly very happy afterwards. But we were talking about this patient on the last show that we did, and we were talking a little bit about bony defects that can occur in the forehead region after traumas, things like car accidents, or if you get punched or something like that, and the part of the bone on the forehead breaks. So, of course, you're going to go into an emergency room, and eventually you're going to get that repaired. But there's still going to be a scar, and there's still going to be a contour irregularity there. So for this particular patient, and for anyone that had a defect in that area, you can bring the hairline down to cover it up. But again, you're going to still have a contour irregularity there. So if you do fat transplants to that area, you can really smooth it out. So just to show you what you can do, again, on that particular patient, you can bring down the hairline and cover up anything that was up here before. And then you can bring it down up to about an inch, which was about 2.5 centimeters. So after that, if there's still a contour irregularity there, you can do fat transplants. And again, you get those from the body, and you process it, and you put it back into the area that you want to do it, and it can help smooth out the area. Same thing for this patient under her eyes. Just to go back again to her previous photo, patients that have bags under the eyes, or maybe part of the eye is hanging, like you said, from a trauma, or for various other reasons that you have eye problems, not just aging. We're talking a lot about reconstructive reasons to have that.
Reconstruction, that's right.
Tumors and things like that. So once you remove these bags from under the eye, and she has the same thing on the other side, it's going to look hollow there if that's all you do. So just to show you what she looked like after that, once you take out the fat, what you also want to do is put fat back in. And it seems counterintuitive, but really what you're trying to do is smooth out the area, because when the light hits it, it creates a shadow. And if you just take out fat, you're going to have a hollow there, which is going to look even worse with the way that the light is hitting it. So this patient had the bags removed under the eyes, and then fat injections or fat transplants put in to smooth it out. And this is what it can look like. Same thing in her cheeks, just to go back one more time here.
Okay, go ahead.
The cheek area. You can see that she had very flat cheeks before, and this patient did not have a facelift. I don't know if I mentioned that before.
Yeah.
Not a facelift. This is just done on the cheek area with fat injections, fat transplants to build that cheek back up to a more youthful look. And again, this is what it looks like afterwards here, with a much more rounded cheek. Now, if she was someone that had a problem just on one side, you could go ahead and do fat injections on just one side to try to build it back up to look more like the other side.
Yeah.
So
well, you also mentioned what shadow patterns. What are shadow patterns? What exactly is that?
When you're looking at the face, there are different shadows that can be created by the lighting. So for instance, if you take a picture with a camera and you use a flash, or if you take that same picture with a camera without a flash, the two pictures can look completely different afterwards. I'm, someone who's in TV a lot. I'm sure
yeah, that's right. That's right.
A little bit about
the
that
lighting
as well.
has a lot to do with it.
The lighting has a lot to do with it. It can really drown out different things on the face if there's a lot of lighting versus if there's not a lot of lighting, you see the contrasts on the face better. So when, let's say you're in the bathroom and you're getting ready in the morning and you have lights that are on the vanity there and they're pointing at you, you're going to look a lot different in that than you are, let's say, in your office where you have the lights from the ceiling above.
That's right, that's right.
So for instance, on the lower eyelid area that we were just talking about, when you have a hollow area there and the lights are coming at you, from a mirror, it actually looks pretty good. You don't really see that concavity.
That's
or
right.
the problem that you have.
That's
but when
right.
you're in the office that you work in and the lights are coming from above, they're going to bounce off of the orbital rim here, and it's going to make it look even worse. So depending on the different shadows that are created by the different lighting, things can look better and worse.
That's what happens to me, because when I go in, when I wake up in the morning, I go in, I go in the bathroom, and I shave and everything, and I look really terrific and everything else. And then just as I'm stepping out the door, and I look in the mirror as I'm walking out the door, and I look terrible.
I wouldn't say that.
Well, I know, but that's the shadow patterns.
Right, it's the shadow patterns that are doing that. So if you do fat injections to try to eliminate those concavities, you look good in any light.
Yeah,
really.
well, good. Yeah, that's right. Facial defects, where two people, not two people, one person looks like two people, one on different sides and everything else. What happens with that?
That's more common than you really think. I mean, if you really study faces, you'll see that a lot of people have some differences on one side versus the other. So even celebrities can have differences. There's a lot of celebrities out there that have very different faces on one side versus the other.
Yeah, they look like two different people.
So if you do like a split face, and you recreate one side from the other, and you do that the same thing on the other side, you'll have two different people on those pictures. That's how different it can be. Tom Cruise is an excellent example of that.
Yeah, sometimes when I go to the movies, and I see. I see two people that look alike. I can't tell the difference between one person to the next, except when they turn their face to the side and stuff like that.
Sure.
Yeah, it's very confusing for me. So I don't know if it's confusing for everybody else, but I get confused from different characters in different films because some people look so much alike and then so much difference. I can't tell sometimes.
Well, I mean, if you take, there's a lot of different reasons for asymmetries and things like that. So if it looks different on one side versus the other, that can happen just from that's the way they were born, or it can be from something else. We should talk a little bit more about the reason that cancer can cause those kind of things.
Yeah, that's right.
Trauma, of course, can
stroke.
cause one different stroke. It's a great example of why you would look different on one side versus the other.
Yeah.
There's something called hemifacial hypertrophy, where people are born this way, where one side of their face grows more than the other side.
Yeah.
And that's something that can also not necessarily be corrected, but disguised.
Yeah. All right. How can you disguise that?
Right. Well, take different parts for different things. If the cheek on one side is bigger than the other side, you can use fat injections to build that cheek back up.
Okay.
Really anything can be built back up with fat injections. Giving hemifacial hypertrophy as an example, this patient I saw recently had her nose also being pulled over to one side because of the hypertrophy.
Oh, wow.
So that patient would not only need to have the cheek built back up, but also a rhinoplasty to move the nose back into the middle.
And you can actually do that. You can move the nose.
You can actually do that by reshaping the nose and pulling it back over. That's a common thing that's actually done.
Wow. Oh my God.
So you
Isn't
also
that something?
mentioned
stroke. I want to get into stroke, and I want you to tell me, how can you correct a person's face after they have a stroke? Because I mean, their lips are hanging, everything is hanging. I mean, how would you do that?
Well, let me show a picture. This particular patient didn't have a stroke, but it's just sort of an example of what can happen after having a stroke. Now, strokes can affect different parts of the body, of course. So if we're just talking about the face here, when you have a stroke, you have nerve problems after that. Sometimes you lose complete function of some of those nerves. Sometimes they're just weak. So you can get areas of the face that just start sagging down. So, if you have the jawline sagging down or the cheek sagging down, you would have to just lift that side of the face back up. But what also happens, I mentioned the nerve damage. Nerves innervate muscles. So if there's no nerve innervation to the muscles, if it's damaged with stroke, the muscles actually atrophy.
Oh, wow.
And they get smaller. That's what atrophy means. So you would have to not only pull, but you'd also have to build that back up with fat injections. And you're never going to actually give the person the function back from the nerve damage that they had from stroke, but you can at least make it look like it. You can sort of disguise it and add things to it and pull it in certain ways so that when they're not moving, it does look symmetric between the two sides.
Oh my.
And just, as an example of how much you can pull things up,
Yeah.
you just saw this patient, and you can see how much the jawline has been pulled back, how much the cheeks have been pulled back.
Oh, that's
and how
amazing.
the cheeks have been built up.
Yeah.
So if she was a stroke patient and just had that on one side, you could pull it back and build it back up to look like this.
Wow. Oh,
So
wow.
It's quite a difference there. She
It's-
also had other things done too to
Yeah,
the
yeah.
neck and the eyelids, but we're just talking about the.
Now, is that major surgery?
No, these kind of procedures can be done in an office setting under local anesthesia.
Really?
There's just some sedation that's given via the mouth. There's no IVs, no breathing tubes. Patients most of the time sort of fall asleep during the procedure because they don't really know what's going on.
Oh, wow.
But these are not major surgeries, and typically they only take anywhere from an hour to 3 hours, depending on what's being done.
Isn't that wonderful? And then after cancer patients also, what happens with that now?
Well, you think of cancer as removing something. Well, you certainly are removing the mass or the cancer that's there.
Yeah.
But there are other things in the area that are generally affected as well. Usually it has done some damage to the muscles. It's done some damage to the nerves, the
yes.
fat, and those kind of things. So it's almost similar to stroke, where you lose innervation of some of the muscles because the nerves are damaged, and some of those things can atrophy afterwards. Not only from just taking out the cancer, what the cancer has done, but also from the radiation, or even chemotherapy can cause atrophy in certain areas. So if that happens and the skin is sagging, you can pull it back up with some type of lifting procedure on the face and fill it back in with fat injections, and they typically work very well to rebuild parts of the face that have atrophied.
This is, would this be like facial sculpturing, or how would that? I mean, were you just you're like an artist with a with clay and stuff like that, and they just?
Well, there's definitely a sculpting aspect to it, because you have to get the fat in there, and there's some artistic impression that you have to use, and there's, again, it's just a sense of artistry that goes into it.
Yeah.
So you're putting the fat injections in there and getting it to look great, but you also have to anticipate how the healing process is going to happen and how the fat is going to change over time. And depending on how you're doing this will affect how much of that fat actually survives. So you really have to have a good experience in doing the procedure to know how the fat is going to actually act after the procedure. Like I said in the last episode, I've done over 700 of these type of fat injection procedures.
Plus.
Plus more. So I have a pretty good idea how the fat is going to act.
Yeah.
So it's not just as simple as taking fat out of the belly, washing it off, and putting it in. There's a lot more that goes into it in order to actually get it to survive. It's just like any other transplant. The time that it's out of the body matters. If you take a kidney out or a liver out, there's a certain amount of time that you have that you can put it back in.
Yeah.
So you have to make sure you're experienced enough to actually take that fat out, wash it, do the processing of it, and get it back in a timely manner. You also can't just take a needle and inject it all in the same place.
Okay.
We're talking about building up the cheeks, and it's not just as simple as me taking that fat in a needle and just squirting it into the cheeks.
Okay.
You have to make sure that the fat redevelops a blood supply. So you have to put very tiny amounts in just about every area of the cheek to sort of build it up so that it can actually attach a blood supply.
Yeah.
If you just squirt that fat in and all in one place, sure, you could do that in about 5 seconds.
Yeah.
But it's never going to work. The fat's just going to dissolve
So
away.
how many injections do you do then?
Well, the needle never actually comes out. It just comes out to the edge and it goes right back in. So you're only puncturing the skin one time.
Oh.
So to build an entire cheek up,
Yeah.
it takes one tiny needle puncture in order to build the entire cheek up.
And you could hardly feel it.
And I can do the folds here, I can do down here, and the entire cheek area, all from one needle puncture right here,
Oh my God, that's real artistry.
and one on the other side.
Wow.
So the needle does come in and out several times, but never actually leaves the skin.
Oh, I
and
see.
it's going into these little patterns in the cheek area so that it can get just about every area of the cheek, everywhere there's going to be a little blood vessel that can attach onto the fat to help that fat survive.
Okay.
That's the biggest mistake that some of the doctors make that are doing this, is that they treat it like some of these temporary fillers. There's 30 or more temporary fillers. I won't mention any of the names.
Yeah,
brand
well, there's
names.
silicon, I'll mention them. There's silicon, there's stuff like that, and everything else. But this is regular fat where do you get this fat from?
So,
And-
the fat basically comes from the body.
Yeah.
The fat is, you have fat all over your body.
Okay.
Some of the fat is better than other fat, believe
Okay,
it or not.
okay.
Nobody thinks fat is a good thing, but
Okay.
some of the fat actually works better than the other fat. The fat under the chin doesn't work well.
Yeah.
The fat on the jawline, I really can't move that around either because that doesn't seem to work well either.
Yeah.
But the fat on the abdomen, on the love handles, on the lateral thigh, the medial knee, all those areas, the fat has more stem cells, so it tends to survive better
Yeah.
when I
And
transplant it.
how long does it last?
Well, with the fat transplants, about 30 to 50% of it is going to stay there. And it's dependent on how you do it.
Okay.
Because if it's done the wrong way, it's just going to go away within a matter of days or weeks.
Okay, all
But
right.
if it's done the right way, it integrates into the tissues that you have there,
Yeah.
into the fat and into the muscle.
Yeah.
And it can survive lifelong. They've done studies
Yeah.
where they've taken MRIs of a patient before the fat injection, 3 years after the fat injection, even longer out than that. I think somewhere even 5 years. And you can distinctly see the fat on those MRIs. So we know the fat stays there.
Yeah,
There's
yeah.
no disputing that.
Yeah.
They've also done studies where they've done 3D pictures of patients. And they've taken that picture and they've taken it years later, and you can still see the volume last. These people are not doing it over and over again. Now, if someone comes in and says, "Hey, Dr. Ende,
Yeah.
I look better,
Okay.
but I wish my cheek was just a little bit bigger,"
Yeah.
we can certainly put more fat in. There's always going to be more fat that I can find on the body
Yeah, all right.
and be able to transplant it. We don't do it right away because, like I said, the fat does change a little bit over time.
Okay.
So we usually wait about 6 months, and then we can inject a little bit more fat
Oh, I see.
into the areas that they
All
need
right.
it. And that generally works very well.
And they can come in for touch-ups and so on and so forth and everything else.
Nobody minds donating more fat, like we said.
I know. And this is a special technique that you developed that really takes out all the error.
Sure. Well, I didn't come up with the original idea. I don't want to take credit for that.
Okay.
Most of us in the facial plastic surgery world credit Sidney Coleman for doing a lot of these fat injections, and he's certainly the pioneer of it.
Yeah.
But a lot of us have taken what he's done and changed the techniques a little bit to make them even better.
Yeah, keep on improving them, yeah.
Improving them. So certainly my technique has evolved a lot from the teachings of Sidney Coleman.
Yeah, that's wonderful. I want to get back to the nerve damage. Can you tell us a little bit how the patient, what the patient goes through actually with reconstruction,
Sure.
of the face with nerve damage and stuff?
With nerve damage, let's say it's a stroke or cancer, something like that.
Yeah.
If there's no innervation to the muscle, that muscle atrophies over time, and it's not something that happens immediately. You don't see someone with a stroke all of a sudden the side of their face looks smaller. That's not something that happens. But over time, as the muscles shrink, the side that it's happening on looks smaller. Another thing is around the mouth area.
Yeah.
With nerve damage and things like that, the mouth can actually rotate. You've probably seen people that have had strokes where not only is everything sagging down, but it's rotated.
Yeah.
So specifically around the mouth, you can do a few things to get that to rotate back. There's a procedure that involves a small incision in the fold right here, and a small incision under the nose, which is in the crease of the nose, so you really don't see it, and that helps rotate the mouth back. But also with the nerve problems, that side of the lip can get smaller.
Yeah.
So you would want to build that lip back up with more fat injections so it looks more like the other side.
Yeah.
So not only are you lifting it, you're rotating it back, and you're also putting more fat in, so that when someone's resting and you're just looking at them and they're not moving their mouth, it looks normal.
Wow.
But this really can't fix the actual nerve damage.
Yeah.
But you're making it look like you did.
You make it look like it did. But the thing is, if the person's lip is hanging and stuff like that, with a small injection, you could actually move the lip
Sure.
to a different position on the face and everything.
Think about the corner of the mouth. Let me show a picture here.
Wow, that's absolutely amazing.
If we
That's amazing.
If we take a look at this picture here, we can see at the corner of her mouth, she has a line right here. Now, there's 3 different positions that line could be. The line can be down, it can be over here, and it can be up as well. when the line is up, that makes you look happy. When the line is down, it makes you look sad.
Oh, that's right. That's right.
So it's an important thing. You don't want to walk around where everyone's thinking you're angry or you're sad when you're really not.
Yeah,
It's the same
yeah.
thing with the eyes. When you have bags under the eyes, it makes you look tired.
Yeah.
Even though you're not tired, but there's no way you can get around it.
Okay, speaking about the eyes, you know, they have a lot of Eurasian people around and everything else, and the eyes are different slanted and stuff like that. Can you actually change those eyes?
You can change the shape of an eye, but that's a sensitive topic because then you get into what we call westernization of the eyelid.
Yeah.
Patients that are Asian have what we call an epicanthal fold. That's when we look at Danny's eyes here, we have a nice upper eyelid crease, and then it stops. When you look at some of the Asian eyelids,
Yeah.
they come into a little fold near the nose instead of coming into a crease there. I don't have any pictures today
Okay.
to show that.
All right.
But you can actually remove that fold and what we call westernize the eye. And,
Really?
that used to be a popular thing to do.
Yeah.
It's not so popular anymore, but we do get requests for it every once in a while.
Isn't that interesting?
But you can definitely change the shape of the eye. There's other examples of that too.
Yeah.
On the lower eyelids. In the past, people used to have surgeries where the surgeon would actually make an incision underneath the eyelashes. Most of the surgeries that I do, we don't use incisions on the outside. Everything's done from the inside.
All right.
But because of that, a lot of times the eyelid would actually just get pulled down, okay? And that would change the shape of the eye. You go from having a nice almond-shaped eye to having more of a circular eye.
Yeah.
And it looked very surgical. Everyone knew that
Oh,
they
it
had
would.
surgery.
Oh, okay.
So there are ways that we can have the shape change back to an almond from a circle without making any cuts
Yeah.
underneath the eyelashes. So yes, we can change the shape of the eye with a lot of different
Yeah,
techniques.
yeah. And you're an artist. You're such an artist that you could actually you can give the patient exactly what they want as far as the shape of the eye.
Sure, we certainly talk about the outcomes that we expect.
Yeah.
And I want people to be able to anticipate what it's actually going to be looking like afterwards.
Yeah.
And make sure they have realistic expectations. Because
yeah.
we can't take a guy and make him look like Brad Pitt if he doesn't look
Oh,
anything like
all
it.
right,
But,
all right. Well, there's others that look a lot better, I
so
think.
we can change shapes and shadows and things like that. So
Yeah,
we
yeah.
can certainly help people.
Now, when people come in and when they do facial reconstruction and when they do, you know, from stroke and from cancer and from scars and other things, does the insurance cover it?
That's a great question, and things are constantly changing in the insurance world. It really depends on what insurance company you have, how much coverage you have, deductibles. There's a lot of different things that go into it. In general, the insurance company won't pay for anything that is purely cosmetic.
Okay.
But if it's functional, they will pay for it. So
They-
if you have a lip problem
Yeah.
or you're drooling, we can do procedures like I mentioned last time on the show where we reconstruct the corner of the mouth
Yeah.
so that you don't drool anymore. And we have to add fat injections in there to build it up so that you don't drool anymore.
Okay.
So insurance companies will pay for those types of reconstructions. As another example, someone who's had a Bell's palsy. Do you know what Bell's palsy
Yes.
is? Where you have all of a sudden, it's almost like a stroke. You lose nerve function there.
Yeah, yeah.
And a lot of times it comes back, but sometimes it doesn't. And let's say the corner of the mouth droops down.
Yeah.
From a Bell's palsy. The insurance companies will cover that.
We'll cover that.
A lot of it. They're not necessarily going to cover the cosmetic part of it,
Yeah.
but the functional part of it they're going to cover. And you could do both at the same time. You can have the insurance company cover the functional part, and if you just want to have one surgery, then you would pay the additional charge to do the cosmetic
What
part.
percentage is functional and what percentage is cosmetic?
It depends on the doctor's practice.
Okay,
but
all right.
In my practice, I do quite a bit of cosmetic and also do a lot of functional. It's really whatever the patient needs,
Yeah.
honestly. Not everybody that's coming in to see me is just doing it because they got older and they want to look younger. There's more to it than that. There's a lot of reconstruction that goes into my practice
Yeah.
in terms of the eyelids, the mouth. I mentioned the eyelids being pulled down and the shape of the eyes changing.
Yeah.
It's not just the shape. You might have a dry eye.
That's right.
From getting the
I have
pulled
dry
down.
eyes.
So
Yeah,
there you go.
yeah.
So if the eyelid is pulled down and there's a lot of air getting in there, it's actually considered reconstruction to pull that back up so that you don't have such a dry eye problem anymore.
Oh,
So
my.
not everything is cosmetic. There are things that are actually functional. Functional can mean drooling, it can mean dry eye, it can mean a lot of different things.
Yeah.
Chewing, swallowing, all those different things.
Yeah, well, that's wonderful. I tell you, my God, I had some surgery done, some eye surgery, and I had like scraping in my eyes, and And then when I went to a doctor, they told me that I had like little polyps on the inside, and they had to be scraped off. So I went to the hospital, I had the operation done, and then I came back, I had it again, and then I found out after going to another doctor that there were dry eyes, just dry eyes.
Sure.
And all I had to do was just put drops in and stuff like that.
So drops definitely work very well.
Yeah.
There's over-the-counter drops, there's prescription drops.
Yeah.
But if a patient has an actual problem where the eyelid is averted and there's a lot of air getting in there, you could put all the drops in the world in there, and it's not going to help.
And it still doesn't correct it.
It's not going to help.
But you can correct it and everything.
You can correct it by doing some of these easy techniques under local anesthesia. You don't even need general anesthesia for this anymore.
Isn't that wonderful?
So it takes a lot of the risk out.
Tell everybody where they can get a hold of you.
I have a couple of websites for my hair restoration. We have www.hairrestorationofnewyork.com.
Okay.
And for patients that want to look at the fat injection techniques and other facial plastic surgery, they would go to www.drende.com.
Yeah, which is wonderful, which is really wonderful. But my God, there's so much to cover up here. You got pages and pages and pages to cover. What else didn't we cover that you want to go and talk about? Again, the reconstruction, the hair, the eyelids, the everything going on.
I wish we almost had more time. I have so many different things to talk about with you for reconstructions and things like that. I mean, we've covered quite a few topics, but I'm glad to see that that the public has such an interest in what I do. So
sure, it's fabulous. It's good to, the more knowledge that the public has, the better it is for them, because then they know exactly what they really should do. They shouldn't get scared about anything. They can always correct different things. To look better, to love themselves better, to feel better, to go through a happier life,
and to not get a constant reminder of a certain scar in their face that reminds them of a bad time in life and things like that.
So there's hope for everyone.
There's a lot of emotional stuff that goes into this. It's
That's
not
exactly
just the way it looks. There's, we really have to think about how the person feels about these certain things, not just the way they look.
Yeah, exactly right. And a portion of it is covered by insurance.
Absolutely.
So they don't have to be afraid that it's out of pocket.
And they have to come in and find out to see if it's going to be covered and what's going to be covered and if it's partially covered. Just to the audience, it's not just rich people that are going out to look better. There's a lot of functional parts to this that really anybody could come in and find out what to do about it.
Yeah, they'll have a happier life, to live longer, and everything else. They just have to call you, and you'll give them all the information.
Absolutely.
Yeah, which is really wonderful.
Okay, Danny, it was great being on again with you.
It's wonderful being here with you, too.
Plenty more topics that I'm sure your audience would enjoy hearing about.
Yeah, we just love it, absolutely love it, and we're still going, and we're still going, and let's continue to go until we get a wrap over here. And what else we got? My God, I have to reiterate. My God, you're double board certified. You didn't do 700. You did maybe 7,000. You probably forgot.
Close to 8,000 surgeries on the face now.
8,000 surgeries.
Hair transplants, hairline lowerings.
Really?
Surgeries on the forehead, upper eyelids, lower eyelids.
Oh my God.
We do a lot of laser resurfacing as well, for wrinkles and things like that. We were talking about scars before. Laser is really a great thing to help fade a scar away. It can remove tattoos, it can remove scars, brown spots, wrinkles, fine lines.
Oh, that's wonderful.
Color irregularities. There's a lot of different things that lasers can do to smooth things out. We do the fat injections. I also do temporary fillers. We really didn't get into that very much.
What is a temporary filler? Tell me real quick.
Temporary filler is something like a hyaluronic acid filler. That's just a generic name. There's about 10 different ones that are hyaluronic acid fillers.
Okay.
Hyaluronic acid is actually something that is in your skin surface already.
Okay.
But they used to use rooster combs to derive it. Now they have a chemical process that they use.
Rooster combs?
Yeah.
What is a rooster? Oh, a rooster comb with those big things like this.
Exactly.
Okay, go ahead.
So now they have a chemical process that they use to actually create these products. And they're very similar to what you already have in your skin.
Yeah.
And it's like a gel. It actually goes in there and it fills in certain areas, and it's hydrophilic.